Hello, in this video, I'm going to talk about the difference between epinephrine and norepinephrine. Now, we know that they are two chemicals that work together, especially in our fight or flight response. And so they do share a lot of similarities and a lot of similar functions, but there are some key differences between the two, and that's what I'm going to point out here. So epinephrine is also referred to as adrenaline, and norepinephrine is also called noradrenaline. So epinephrine stimulates all alpha and beta receptors equally, whereas norepinephrine only acts on alpha receptors and some beta receptors, primarily beta 1 receptors. So norepinephrine is more limited in terms of the adrenal receptors that are targeted, whereas epinephrine targets all of the adrenal receptors. Epinephrine has a wider range of effects than norepinephrine. So the receptors that are stimulated by epinephrine are found on tissues throughout the whole body. So we find them on the heart, blood vessels, lungs, muscles, eyes, liver, all throughout the body and many different organs. So we have a lot of different effects of epinephrine on many different functions throughout the body. Norepinephrine acts on a fewer number of receptor types, and those fewer receptors are found in fewer places. So norepinephrine primarily is going to act on the heart and blood vessels, and mostly its job is to increase and maintain blood pressure. Epinephrine is released only during fight or flight, so only during sympathetic stimulation of the nervous system, whereas norepinephrine is released continuously and is found in low levels throughout the body all the time. Epinephrine is used as a hormone way more than it's used as a neurotransmitter, and it is the exact opposite for norepinephrine. So both chemicals are used as both hormones and neurotransmitters. But epinephrine is used way more as a hormone released by the adrenal medulla than it is as a neurotransmitter released by a neuron. It's the opposite for norepinephrine. It's used far more often as a neurotransmitter and is actually the most common neurotransmitter in the sympathetic nervous system and is used much less as a hormone, where it is also secreted by the adrenal medulla along with epinephrine. The precursor for the two chemicals is also different. Epinephrine is made from norepinephrine as the precursor, whereas norepinephrine is made from dopamine as the precursor. The medicinally, epinephrine and norepinephrine are both used to treat certain conditions, especially in emergency situations. Epinephrine is used to treat anaphylaxis, so anaphylactic shock and allergic responses, severe asthma, and emergent low blood pressure. And norepinephrine is used to treat emergent low blood pressure. So emergent low blood pressure, like in extreme cases, someone's in the emergency room, they've lost a lot of blood and blood pressure is dropping, then they might be given norepinephrine to reverse the condition and help to increase blood pressure. Epinephrine, think like EpiPen. It's used commonly in the case of severe allergic reactions because one of its effects is to dilate the bronchi in the lungs and also dilate certain blood vessels. So it helps to restore breathing and other functions throughout the body. All right, thank you so much for watching this video and hope you have a great day.